The body is a sophisticated, interconnected system that functions as one. So it's no wonder that something like a simple rash could signal a deeper health issue elsewhere in the body. To that effect, there have been studies suggesting a direct link between the appearance of wrinkles and the development of osteoporosis in women. So what is the connection between facial skin and bone health? To help us make sense of this rather interesting relationship is Naturopath Dr. Faryal Luhar, all the way from Canada via Zoom. Thank you so much for joining us.
Thank you so much for having me.
That's a pleasure. Now tell us, Faryal, what is the relationship between wrinkles and osteoporosis? Because it's quite an unusual thing to think about, and it hasn't been discussed in that much detail, certainly in the mainstream. So let us in on that context.
I'm so delighted that we're discussing this topic because it's actually quite fascinating, Michael. And yes, you're absolutely right. We don't really think a lot about the connection between wrinkles and osteoporosis, right? Which is about bone health. So essentially what's happening is there's been some research over the last couple of years that is indicating that the well-being of the skin, in particular on the face, can reflect the well-being of our skeleton, of our bones. And so what has been suggested, not yet 100% proven, but what has been suggested is that when there is the appearance of fine lines and wrinkles, things like laugh lines, crow's feet, especially the furrows between the brows, the eyebrows, this can indicate a lower bone density, which can lead to osteoporosis.
Okay, but now all people are going to wrinkle as they age. I mean, I think it's inevitable, so I'm not insulting anybody here. How do you know which wrinkles might be pointing specifically to osteoporosis?
That's a great question. And so, yes, you're absolutely right. Wrinkling is a natural phenomenon with aging. And it's important to point out also that there are other factors involved with the wrinkling of the skin, right? So it's also about sun exposure, environmental toxins, poor diet, and in particular, chronic disease. And so as we get older, chronic diseases start to also set in more, and that gives us a backdrop of inflammation. So if we have lots of inflammation happening in the body, it's going to reflect in the skin, and it's also going to reflect in the bones. And so there are different mechanisms involved here, which we'll get into, but a lot of it also has to do with hormonal health, which starts to change as we get older. And so wrinkles appearing on the face start to appear more and more, in particular with women as they're approaching menopause. Okay. And so there is a hormonal link there. And then there's also the link with what is happening with the skin itself, the structure of the skin and the structure of the bones, which have very many similarities.
Well, obviously, when you talk about skin and bones, a very common factor or something we know is linked there is collagen. So I imagine there would be some kind of impact of that process in the body.
You're absolutely right. So if we talk about bone is a very complex structure. And as you said earlier, each system in the body is interconnected with another system. So there are going to be effects happening in different parts of the body. And with the bone being so complex, there are various minerals and vitamins and proteins and so many different kinds of factors that are required for healthy bones. And so you may have heard the term matrix, right? We have a matrix in the bone that's made up of bone cells, which are called osteocytes. Now that matrix, it's like a meshwork. And that meshwork provides the tensile strength, it provides the flexibility, it provides the density required for the bones to be strong and healthy. That matrix in particular is made out of a protein called collagen. We have different kinds of collagen, type 1, type 2, type 3, type 4. And so this is the commonality between bone and skin because we require collagen to make the matrix for the skin as well, to give it its suppleness, its elasticity, its firmness. So that's where they are similar.
Okay. And what are some of the other factors that contribute to low bone density, which could eventually lead to osteoporosis?
So, of course, lifestyle plays a big role. If you're quite sedentary and not moving too much, then unfortunately the bones are going to start to lose their strength. And with bone density, we have this balance between the rebuilding of bones or the remodeling of bone structure and the sort of, breaking down of certain bone cells that need to be recycled. And that balance is really, really important. But what happens in osteoporosis is, for various reasons, the osteoclasts, which are what break down bone, that is happening at a much faster rate. And
Okay.
so it can't keep up with the remodeling or the building of bone. And this can be linked to diet, of course. If we're eating a very, very westernized diet full of processed foods, then the body's not going to get the vitamins, the minerals, and all of the other important nutrients required to build the bone. It could also be due to stress, because various hormones are released during stress that also impact bone health. And then, as we said, with aging, there are some natural things happening, inflammation and so on, that also impact bone health.
Okay. Now, apart from the onset of wrinkles and particular wrinkles, are there any other symptoms that might indicate low bone mass?
I mean, unfortunately, the most prevalent symptom is a fracture, right? So we tend to see patients who complain of pain in their bones, in particular the hips, the femur, or the femoral head, where it attaches into the hip bones, the low back, the spine. And so what is generally recommended, especially for men and women who are getting older past the age of 50, is to get what's called a bone density scan. It's a DEXA scan that helps to actually look at how dense the bones are. And so that's the main clue. We do know that because of the hormonal link, and I'll just get into that a little bit, with women, as they're approaching menopause, there is a decline in estrogen levels. Now, estrogen is a really, really important hormone for female physiology, because there are estrogen receptors in different systems of the body. We have estrogen receptors on the bone, we have estrogen receptors in the skin. So that's another common link, because estrogen is actually required to stimulate collagen synthesis.
Right.
It's important for the firmness, the hydration of the skin, right? So your viewers will have heard of hyaluronic acid, which is one of those connective tissue components that is now so common in many, many skincare regimens, because that's what attracts moisture and keeps the skin hydrated and keeps it nice and moist and supple and bouncy. And so when we have declines in estrogen, we start to lose these important factors. And in fact, research is showing us that, with every postmenopausal year, women are losing 1% of their collagen production. So by the time they are 5 years post-menopause, they've lost 30% of collagen.
What good things can we do in our lives to keep both skin and bone healthy in the body?
That's a really, really important aspect, because we obviously want to, look more at prevention. And again, unfortunately, with osteoporosis, if it's quite bad and there are fractures, this can lead to a very, very low quality of life, right? So we want to ensure that people are aware that they need to keep their bone strength up and healthy. So from a lifestyle point of view, if I were to talk about just movement, that's going to be really important. So weight-bearing exercises are going to be super important. Using the body weight itself, exercises such as yoga or anything where you're using body weight. You can use strength training with weights, and the weights don't have to be very, very heavy weights, right? 2 to 5 pound weights are fine. And so that's important. Movement is really important. So getting away from sedentary living. The other thing is going to be diet. And so this is critical because, as I mentioned before, we need these various nutrients. Vitamin D, for example, and calcium are really important for bone health. And so vitamin D helps the calcium to be absorbed into the bones. There are other nutrients like vitamin K, other minerals such as strontium, phosphorus, boron. These are all important, magnesium. And you can get a lot of this from eating whole processed foods, lots of vegetables, green leafies, and even hyaluronic acid, which I mentioned previously, is very, very high in something that I love to tell my patients to take all the time, which is bone broth, because bone broth contains a lot of really powerful amino acids, protein, and many of the factors required to build up bones, but it's also really amazing for skin health. So inevitably, when people have issues with their skin and they start drinking bone broth, the skin issues also resolve. Vitamin C is really critical because it is actually the building block for collagen. So that is one of the things that I would strongly be recommending, and you can certainly take these things, even collagen itself, you could take it as a supplement. It comes in powdered forms or it comes in pills. You can do the same with vitamin C. You can get it in your diet as well. So these would be the areas that I would focus on to help build bone health and to, reinvigorate the skin and give it its youthful look again.
Okay, fantastic. Well, thank you so much, Dr. Faryal. It's always great to chat to you. And
My
thank you so much for making
Thank
the
you.
effort to get up early to chat to us today.
My pleasure. Thank you.
Wonderful.